Have you ever been out for a walk and suddenly a deep, aching cramp grips your calf or thigh? But the strange part is, the second you sit down to rest, the pain completely disappears. Most people brush this off. They blame it on getting older, being out of shape, or just a random muscle spasm. But sometimes, this specific type of leg pain is not just a muscle problem at all. It can be a warning sign of a circulation issue called Peripheral Artery Disease, or PAD, a condition that is linked with a higher risk of heart attack and stroke. Today, we are uncovering the hidden connection between your legs and your heart, and why a simple, painless 15-minute test could help catch a serious problem early. Let's get into it. We often hear that heart attacks and strokes come out of nowhere, but in many cases, the body may show warning signs long before a major event happens. The problem is, we either ignore these subtle clues, or we simply don't recognize them in time. And one of the most important yet frequently overlooked warning signs may not show up in your chest or your arm, it can show up in your legs. Medical professionals call this condition Peripheral Artery Disease, or PAD. It happens when the arteries that supply blood to your legs become narrowed or blocked by plaque buildup. So how do you know if your leg arteries may be affected? One of the biggest red flags is what doctors call intermittent claudication. This is a very specific, tight cramping or deep ache in your calves, thighs, or buttocks that tends to happen when you walk or exercise. It happens because your muscles need more oxygen during activity, but narrowed arteries may not be able to deliver enough blood flow. When you stop to rest, the demand drops and the pain often fades away. But the warning signs do not stop there. Because blood may be struggling to reach your extremities, you might notice that one foot or lower leg feels colder than the other. That does not always mean a blocked artery, but it can be a sign of reduced circulation, especially when it happens along with pain, numbness, or cramping. Next, look for changes in your skin and hair. Over time, poor circulation can affect the health of the skin and hair follicles. If you've lost hair on your toes or lower legs, or if the skin looks unusually smooth or shiny, that can sometimes point to reduced blood flow. And finally, one of the most concerning symptoms, slow healing wounds. If you get a small scrape, blister, or sore on your foot or lower leg, and it takes a very long time to heal, poor circulation may be part of the reason. When blood flow is reduced, oxygen and nutrients do not reach the area as efficiently, which can make healing more difficult. To understand why your leg can warn you about your heart, we first need to look at what is happening inside your blood vessels. Over time, a sticky mixture of fat, cholesterol, calcium, and other substances, called plaque, can build up on the inner walls of your arteries. Medical professionals call this process atherosclerosis. When this buildup narrows the arteries in your legs, it can cause that painful cramping during walking. Now, you might be thinking, if the blockage is in my leg, how does that relate to a heart attack or stroke? Here's the key point. The plaque in your leg does not usually break off and travel all the way to your heart to cause a heart attack. That's a common misunderstanding. Instead, think of your vascular system like the plumbing in an old house. If one of the major pipes in the basement is badly clogged with rust, that tells you something important. The rest of the plumbing may not be in great shape either. That's exactly how PAD works. The disease that causes plaque buildup, atherosclerosis, is usually a systemic problem. In other words, it often affects blood vessels throughout the body, not just in one isolated place. So, if plaque has built up enough to narrow the arteries in your legs, that can be a major warning sign that atherosclerosis may also be affecting the arteries that supply your heart and brain. A heart attack happens when blood flow in the coronary arteries, the vessels that feed your heart muscle, is severely reduced or suddenly blocked, often because plaque in those arteries ruptures and triggers a clot. A stroke can happen when blood flow to part of the brain is blocked in a similar way. So, the blockage in your leg does not directly cause the heart attack, but it can be an early warning sign that the same disease process may be affecting other critical arteries in your body. If you're getting this kind of leg pain, especially if it comes on with walking and goes away with rest, it's worth taking seriously. If you're getting older or if you have risk factors like smoking, high cholesterol, high blood pressure, diabetes, kidney disease, or a history of cardiovascular problems, your risk of PAD is higher. But even without a long medical history, symptoms like exertional leg cramping, cold feet, or slow healing sores should not be ignored. The good news is, you don't have to guess and you don't have to wait for a major emergency to find out whether your circulation is impaired. There's a simple, painless test called the ankle brachial index test. This test is a game changer, and it usually takes less than 15 minutes. There are no needles, no surgery, and no hospital stay required. A healthcare professional places blood pressure cuffs on your arms and ankles. Then, using a Doppler ultrasound device, they measure and compare the blood pressure in your upper body and lower body. If the blood pressure at your ankle is lower than the pressure in your arm, that can suggest reduced blood flow to the legs and may point to PAD. Identifying this early doesn't mean disaster. In many cases, it means you've caught a problem early enough to do something about it. Your doctor takes the highest blood pressure reading from your ankle and divides it by the highest reading from your arm. That number is your ankle brachial index. In general, an ABI of about 1.0 to 1.4 is considered normal. That means blood pressure in the legs is similar to blood pressure in the arms, which is usually a reassuring sign. If the number is around 0.91 to 0.99, it may be considered borderline. That can be an early signal that blood flow is starting to become affected. If the score is 0.90 or lower, that supports a diagnosis of peripheral artery disease. That means there's likely a significant reduction in blood flow to the legs, and it's a sign that your overall cardiovascular risk deserves serious medical attention. And if the score comes back unusually high, typically over 1.4, that doesn't mean you have amazing circulation. It can mean the arteries are so stiff or calcified that the blood pressure cuff can't compress them properly. This can happen in some people with long-term diabetes or advanced vascular disease, and it usually means more testing is needed. So what should you do if you're experiencing that window shopper cramp, or if you know you're in a higher risk group? Don't try to diagnose yourself at home, and don't panic. Leg pain can have many causes, including muscle strain, joint problems, nerve issues, or other circulation problems. But if your pain reliably appears when you walk and disappears when you rest, especially if you also notice cold skin, hair loss, or slow healing sores, make a regular outpatient appointment with your doctor. They may decide to evaluate you for PAD, and an ABI test may be one of the first steps. Remember, finding plaque in your leg may sound scary, but catching it early can actually be a huge opportunity. It can give you and your doctor time to improve your diet, increase safe physical activity, manage blood pressure or cholesterol, stop smoking, control diabetes, or use medications when needed, all before a more serious cardiovascular event happens. Your body is always giving you signals. The key is knowing when to listen. If this video helped you better understand what your legs may be trying to tell you, hit that like button. It really helps the channel. And make sure to subscribe to Health Decipher for more science-backed breakdowns on how to protect your heart and your health.